I promised you we're going to have a conversation about mental health because, well, World Mental Health Day has been celebrated. The key concerns that have been raised regarding the kind of support that society has, how our national health insurance scheme, our social protection policies and standpoint, and how we stigmatize persons who are living with the mental illness. I've been joined in studio by Vivian F. Sapoma Fishian. She's a leadership and governance advisor with Ghana Somubi Jumadie, and also a man from Basic Needs, Better Mental Health, and they talk about that. Peter Badimok Yaro's executive director. Ladies and gentlemen, welcome. Good morning. How are you doing?
Good morning, and thank you.
Trust we're fine.
Good.
Let's do an overview. World Mental Health Day comes every now and then. I'll start with you, Peter. Has it struck any chord yet in Ghana?
Yes, thank you very much. I think it has. It's close to 2 decades now since the World Mental Health Day started, and it is this day that has helped to galvanize support for mental health over the years, particularly building media interest in mental health issues. And you would see that it is usually around this time of the year that we get so much coverage from mass media networks and excellent people like you. And so the World Mental Health Day is that occasion that the world converges around mental health issues. And in this country, that is what also happens, taking a cue from the international community, and Ghana being a member of the WHO.
I see. Vivian, your thoughts?
Yeah.
Initial conversation.
A lot has gone on over the years, but yet the issues around mental health continue to be deprioritized by key policy makers and decision makers. And as we celebrate World Mental Health Day, it is a platform and opportunity for us to re-echo a need to focus more on mental health. And for me, I was glad to see on your platform over the last weekend when you crowned your queen for one of the contestants, talked about mental health. And for me, it was something that I said, okay, if nothing at all, the message is getting there. And for such a huge platform,
in fact, in 2016, Baba from Central Region also took mental health. She's a mental health nurse, by the way.
And then to see Seto also taking it as a project. I mean, being the first runner-up, I thought it was a good platform for us to take the conversation forward.
Peter, let me begin this conversation with you. I mean, your knowledge in mental health space in Ghana is undoubted. What would you say have been the main sources of mental health financing in Ghana? Specifically, where do these investments go to?
Main sources have been government and non-government entities, particularly from funding agencies, mainly from the UK and Europe and the USA. Particularly in the UK, the government and people of the United Kingdom, through the Foreign Commonwealth and Development Organization, which was previously DFID, has given quite substantial amount of funding for mental health in Ghana. And as you introduced Vivian, she is one of the directors of the current project funded by the FCDO. We are so used to DFID, but this FCDO, which is called the Ghana Somubi Jumadie, a consortium of organizations working with government, particularly through the Mental Health Authority and the Ministry of Health and the Ministry of Gender, Children and Social Protection, to improve mental health and disability. Government of Ghana has, throughout, as part of health, provided funding for the psychiatric hospitals, is paying for psychiatrists, clinical psychologists, psychiatric nurses, and all allied workers that operate within the mental health subsector of the healthcare system. So it's been a combination of government and non-government. Investments, well, I don't know much about the investment except for areas of training, the medical schools,
right,
the nurses, the psychologists, some of the social workers. So as part of the educational system of the country, government obviously pays for the training of medical officers who go on to specialize in psychiatry, those who specialize in psychiatry nursing, and the rest. That's where it is that investments have been, and of course infrastructure. But as we stand, and why we want to focus on the issue of investments in mental health has been that it's either stagnated or rather declining.
Okay.
When we actually need to transform our mental health care system to the 21st century that it is, unfortunately, the amount of investment that should make that happen is not forthcoming, and that's why this call.
Vivian, so clearly from what Peter is saying, there are barriers, and I'm interested in the local level and how the lack of resources there and continued financing affects people's lives at the local level in terms of mental health. What would you say?
So let me say that at the local level, there's a high level of social exclusion. Most persons with mental health conditions are excluded from economic activity, social activity. Ghana talks about inclusive education, but how many of us are able to get into the system because of our mental health condition?
Right.
And in terms of funding, let me add that if you take Ghana as a country, we spend just about 1.4% of our resources on mental health. And chunk of that funding, like Peter just said, comes from the UK aid. And that is one of the reasons why our program comes in handy. We came in last year. Luckily or unluckily, we were met with COVID. And COVID exposed how much Ghana as a country have downplayed on persons living or persons with mental health conditions. Particularly when we were focusing on PPEs, we were focusing on all other interventions during COVID. Nobody thought about persons with mental health condition. So yes, it's from the local level, but also at the top level, where policy makers, decision makers take a blind eye, consciously, unconsciously, perhaps as a result of the high level of stigma and discrimination that those people suffer.
Peter, when key advocates like you and Vivian and many others say government should prioritize mental health, should focus, should do this, what exactly are you demanding?
We are demanding fairness, we are demanding equity, we are demanding inclusion, we are demanding attention to the least in society who don't have the voice to probably mass around, such as labor unions and the rest, and threaten strike. And so a group of people who have significant challenges, such that in the priority of need, they are probably the most in need who should be focused, but whose needs are not amplified or not known by people. So we are making this appeal in the sense that we cannot continue to talk about development, talk about economic transformation, talk about well-being, talk about human capital development and the rest, when there is a significant proportion of the population that is not catered for the reason that they are feeling unwell, being mentally ill. Even though we invest in physical conditions, we are talking about controlling malaria, there is a vaccine that is coming up, we are talking about cardiovascular conditions, non-communicable diseases, and doing all sorts of things. Even the cardio center has a whole fund. This could have actually been also extended to mental health, because mental health actually needs a dedicated fund to transform it. Right now, when you want to talk about mental health, what comes to people's mind is Accra Psychiatric Hospital.
That's right.
Asylum.
That's right.
Fantang and Ankafo. But we need to develop our mental health care in a way that you can find it almost everywhere you find a health facility. And currently, that is not exactly the case. By pronouncements or by policy, we want, and that's what you so excellently asked, what is happening at the community level.
Right.
By policy, we say we want to have mental health care services everywhere. Practically, that is not the case. We don't have enough psychiatrists, and perhaps the narrative, and I think that's why you're asking, the narrative has to change from, we are just asking that put money into mental health. We are saying, think about the dividends you would get if you invest in mental health. Just as you are somebody who want to invest in shares in a company and expect your dividends, we are also saying that there are dividends you would get when you invest in the individual. The return on investments on an individual is that you have a better human resource, you have a better and a healthy population that can become productive.
Okay.
They will be less of a burden to family, to friends, to society. They can become income earners and contribute to family income and support. So you are not putting money in something that is of cost. You are actually investing in your people to reap.
At the end of
because if you invest in this, you reduce the need for issues of mental health care expenditure. And that, I think, and that is what we...
That's more proactive than being reactive.
Yes, so we are not asking that just sink money, but we are saying that if you are interested in the welfare of the country, we want the country to move from the current middle, low-income country that we have described to an actually proper middle and higher-income country. Your population is something you should focus on because they can drive the growth. They can move you to the next level. And investing in these healthcare is important.
Vivian, let's go back to something that you said earlier, which struck me as well, that when COVID-19 came, I mean, everybody was talking about many different sectors: students, frontline health workers, media, security personnel. Nobody talked about the people living with mental health conditions. Obviously, then their needs were not attended to. How do we do a U-turn to make sure that even as the pandemic is on, and in future, perish the thought, if anything of the sort should happen again, how do we put them in the safe bracket and care for them as we should as a country?
So in putting them in the safe brackets, one of our key social protection mechanisms that we have in the country is the Common Fund.
That's right.
I recently did a review of the implementation of the Common Fund disability component.
Right.
And it was obvious that persons with mental health conditions were not taken care of. Their caregivers were not considered. They did not access the Common Fund. They didn't know the channels. So it's one of the
whole disability community get 3%.
They get 3%. And persons with mental health conditions are part of persons with disability.
That's right.
So you cannot just take a group of persons with disability and leave out those with mental health conditions. And then when you talk about also treatment, for the population that is living with mental health condition or persons with mental health condition, between 85 to 98% do not even have access to treatment. What are we doing? How are we bringing them on board onto our NHIS, National Health Insurance? So this is a kind of thing that we are trying to advocate and push authorities and push these policymakers to ensure that they are not left out, they are considered and they are brought onto the table anytime that we are thinking about persons with mental health conditions. In terms of doing U-turn, perhaps you may also want to find out, we just finished with our population census.
Right.
What was the coverage? What is the data? Where are they located?
Well, they tell us we will do the breakdown by November. We'll get the full detail.
That would be perfect. And I want to know, where are they? How many of them are having access to treatment? In terms of your medication, what is the level of accessibility? We talked about all the psychiatric hospitals being in the southern zone. What happens to those in the middle belt and in the north? Where do they access services of mental health care services? So in terms of U-turn, we need to adopt inclusive approach to healthcare delivery in the country. And that is the only way we can achieve universal health coverage for all persons.
Peter, so on Sunday, the Alliance for Mental Health and Development, they put out a statement. And they had two demands. One, set up the governing board and also the Mental Health Authority. What does the absence of these two bodies do to this whole work that you're doing, Vivian is doing, everybody else? What does the absence cause?
Yeah, and I should add, and you are doing.
I'm trying small.
You've been so excellent since last year and always.
Thank you very much.
Well, the Alliance for Mental Health and Development, which we call the Mental Health Alliance, is a collection of civil society actors that are focusing on mental health and psychosocial disabilities, including the disability fraternity. And we have collectively issued this statement calling on government to bring into being the governing board of the Mental Health Authority. It is the one that provides leadership, provides oversight on the day-to-day operations of the Secretariat of the Mental Health Authority, headed by a chief executive. And they have the muscle to make the representations for proper allocations of resources, for proper attention of the government to mental health issues. And if they are not there, it looks like there is no direction. The chief executive is limited in decisions that he can take without recourse to the government board. So it means mental health issues will come to a standstill because they cannot be enacted and implemented. And that is what is happening. And I think it's similar to when before a few months ago, there were calls on what's happening to the district assemblies, what's happening to the governing boards of state enterprises and agencies. So if they have been able to bring all these in place, then the Mental Health Authority's governing board deserves
a fair demand.
Point. And the second one, we said, the law requires a tribunal to ensure that excesses within the mental health care service system are not perpetrated, particularly those that are not in the formal sector, the informal areas such as traditional healers, and where sometimes there are excesses and there is need to have redress of them. The tribunal is to ensure that takes place, including the visiting committees. And we have also emphasized the need, which Vivian articulated, the National Health Insurance Scheme beginning to include the benefits package for mental health care, because I think there was good reason why they said mental health should be provided free of charge.
Right.
It is clear that free things usually don't really become of good quality, and that is what is facing the mental health care system in Ghana. Rope them into the National Health Insurance, and they are properly budgeted for and reimbursed for services. Then you can talk about quality. If not, for now, you can only rely on the benevolence of the Ministry of Health and the minister who is there, and whether he feels that he should provide something to mental health or not.
Vivian, let me take your closing thoughts. So obviously, we need to prioritize mental health. What would be your top 2 recommendations to the big boys and girls watching this morning?
So my top 2 is for the nation to prioritize mental health, particularly when we are coming out of COVID with its intended consequences and impacts on the population.
Right.
And the second will be properly targeted social intervention that are more inclusive and that does not leave out persons with mental health conditions. And in doing that, it is a way to push and drive the agenda for better well-being of all individuals, all inclusive.
Peter, your closing thoughts.
My closing thought is we cannot continue to ignore mental health. If Ghana would develop, we would need to address issues of mental health. And it doesn't take much.
Right.
It is being in a concerted, committed effort to address the challenges and to continue to appeal to excellent media networks like yours to focus attention on mental health. Yeah, we have done enough of the politics. And I think if at every opportune time you chip in mental health to a politician, perhaps one day we would see attention to it. Because it's so clear that our health and disease dynamics, our healthcare systems are moving towards addressing non-communicable diseases. And mental health is very tough. Its comorbidities and the rest point to the fact that you cannot ignore it. So we need to restructure our healthcare system in a way that it's really responsive to the healthcare needs of the population. As more people become stressed, they are more associated with long-term chronic conditions that come with psychological problems and the rest. You cannot continue to treat hypertension and diabetes with the anxieties people are living with it, and you ignore that. So this is how we think we should go. And if I have the opportunity, as you have given me, that's where I'm emphasizing.
Most grateful. Thank you very much for your time. I'll be speaking with Vivian Sapoma-Fission. She's a leadership and governance advisor with the Ghana Sumubi Jumede. They've come together to make sure that we place a focus on mental health and get the right things done. Also, Mr. Peter Badimak Yaro is Executive Director of Basic Needs. Thank you very much indeed, and God bless the work of your hands.
Thank you, Johnny.
And make sure that your resources will come to you so that you can put smiles on people's faces and give them respite. I'm proud of you. Thank you very much. And a happy birthday to, fifth year birthday to Ayeyi Afrakuma Osei Boateng of Queensland International School. This is from your mom and dad, Esther and Lawrence Osei Boateng. Happy birthday to you. Also, happy birthday to Ajete Mawena Peace. This is from Christian Amos. And congratulations one more time to Jonathan Quist Daku for winning the National YAF Youth Organizer of the Young Adult Fellowship of the Presbyterian Church of Ghana. To Josephine Nana Sapoma Ewa Mami Jo, it's your birthday today. Happy birthday. There's entertainment with Cookie Tea. Guess who's on the bill? Kwame Yogurt. I have both routes. You won't regret. We'll see you after the break.